Joel Michael Singer procedures to treat neurologic conditions. A neurosurgeon, also known as a neurological surgeon. Joel Michael Singer is a highly skilled medical professional who specializes in surgery of the brain, spinal cord, peripheral nerves, and cerebrovascular system. He is trained to treat a wide range of congenital brain disorders, traumas, tumors, vascular disorders, infections, stroke, and degenerative spinal diseases. Joel Michael Singer's surgical experience that few institutions can match. He refers to patients who have the most complex brain and spinal cord conditions. Joel's clinical skills are complemented by their deep commitment to compassionate patient care, supported by a team of nurse practitioners, physician assistants, and staff who are unsurpassed in their training, expertise, and understanding. Lumbar puncture. Lumbar puncture, a healthcare provider withdraws cerebrospinal fluid. A lumbar puncture is used to introduce anesthetic medications or chemotherapy drugs into the cerebrospinal fluid. A needle is carefully injected into the spinal canal in the lumbar area to collect cerebrospinal fluid, CSF. Lumbar punctures are conducted to find the cause of infections, inflammation, cancer, or bleeding around the area surrounding the spinal cord or brain. It can also be used to diagnose certain diseases of the brain and spinal cord as well as release medications to collect cerebrospinal fluid. Lumbar punctures are also managed to deliver a dye to the CSF to make the spinal cord and CSF more visible on X-rays. Electromyography. Electromyography and nerve conduction studies are tests that contain the electrical movement of muscles and nerves. The experiment measures how well and how fast nerves can send electrical signals. It is performed working an instrument called electromyography, which provides a record known as an electromyogram. Measuring the electrical activity in nerves and muscles can help reveal diseases such as muscular dystrophy and amyotrophic lateral sclerosis. Tensilin test. Tensilin is known for edrophonium chloride, which is given intravenously. Tensilin blocks the action of acetylcholinesterase, an important neurotransmitter, and supports prolonged muscle stimulation. An increase in muscle strength during the test can be a symbol of myasthenia gravis or a similar neurological condition. Clinicians should pay attention to the potential life-threatening manifestations of myasthenic crisis before and during the procedure in order to understand it as soon as possible and are familiar with the appropriate and satisfactory management for it. Electroencephalogram. The electrophysiological process records the electrical activity of the brain. Through the test, electrical sensors are connected to the head of the patient and run by wires to a computer. The charges are amplified and develop as a graph on a computer screen, or as a recording that may be printed out on paper. Your healthcare provider then performs the reading. An EEG can be arranged in the doctor's office, a lab, or a hospital. Your child will be asked to rest on a bed or sit in a chair. The EEG technician will attach terminals to different locations on the scalp using adhesive paste. Each electrode is joined to an amplifier and EEG recording machine. Sleep study. Patients who have chronic sleep problems are diagnosed in a sleep study, also recognized as a polysomnogram. During a sleep study, the patient is observed during sleep and physiological data is electronically recorded. This data is carefully examined by a neurologist later. The test is usually completed in a sleep lab. To helping diagnose sleep disorders, polysomnography may be used to help initiatives or adjust your treatment plan if you've previously been diagnosed with a sleep disorder. Conclusion. In the conclusion of the basic and disease-related neuroscience, the field of neuroethics has developed, concerned with the policy advice of the conduct and issues of modern inquiry on the brain. Joel Michael Singer understands that in many cases, these modules raise more questions than they explain. That is the variety of ethics debates and discussions. The cost of bioethics is not to come up with absolute answers to ethical dilemmas, but to investigate the range of problems and consider the possible clarifications and implications. As the social, political, and scientific climates develop and evolve, the answers to the ethical dilemmas will change and evolve as well. The process of asking questions and observing the answers constitutes a primary focus of bioethics work. I hope that these modules have caused deep consideration and deliberation about emerging difficult issues.